this is Sarah coming to you with another video from the Keepers at Home channel. And this video was brought to you by WNC DNA. It's a DNA paternity testing service. We specialize in maternity, paternity, sibling, twin, infidelity, and other array of DNA testing products. Visit us today at www.wnc-dna.com. Okay, let's get into our video. So last time we got together, I spoke to you about the risks that go into the birthing system and my birthing story. Today I wanted to continue with what they're not telling you about C-sections. Okay, so first of all, let's go into the reasons why a woman would need a C-section to begin with, or would want one. First reason I want to discuss with you is convenience. A lot of women want a scheduled birth. They want a birth that they know what's going to happen. The baby's going to be here at a particular time. Maybe they have holidays or something else coming up, and they just want to make sure the baby is there before the big rush, and they're within their window of birth where the baby is going to be a regular infant, not a preemie, not so they fall under that classification, and they just feel fairly confident about their child's health. The next categories are either medium risk to higher risk categories and justifications for cesarean section delivery. So some of those include placental abruption, a prolonged labor where your labor is not moving along as fast as a doctor would like, and so or is just stalled altogether. Some doctors will take a couple steps backwards with the Pitocin, and they will reschedule induction for a future date. More than likely the next day you'd start the process again. Or some doctors will say, this has gone long enough, it's time to get this baby out of you and have your baby in your arms, so they will schedule you for a cesarean section. Fetal distress, this can occur as a result of Pitocin or other factors. More than likely on the intervention roller coaster, it would be after the Pitocin. Active genital herpes, there's a plethora of reasons why you do not want to deliver when you have an active genital herpes outbreak. Blindness is a big cause, as well as other health conditions. Your baby's very large. This is a very popular one, either the size of your child, either too large or too small, and they will justify having you get a C-section. Breech position, several years ago, probably 2007, I enrolled in the Law Enforcement Police Academy, and part of our training was actually delivery of babies. I don't know why I never connected this, but we were actually trained to do a breech birth deliveries. Dispatchers are also given a manual to walk a person through a breech delivery. So breech delivery doesn't necessarily warrant a cesarean section, but it could be the familiarity of your doctor with the procedure. Some doctors do not receive that much training, and they just have never dealt with a C-section. Some doctors are specialists. There's one of the videos that I heavily relied on for this presentation. He's actually, he goes and does seminars on it, and he's just very comfortable with it. He's like the C-section guru. So, and some doctors, on the other hand, don't want to deal with it, which is fine as long as they disclose it to you. So one of the additional questions that I would suggest that you ask your OB when you're shopping around is, how familiar or how comfortable are you performing breech births? If they say I'm not comfortable with it, this is the type of doctor that will propose a C-section later on. Or if they say I haven't done many of them, the lack of experience would lead you to believe as well that this physician, his or her, will prescribe a C-section to you later on. Umbilical cord prolapse. This is a condition where the umbilical cord would cause serious damage to the child if allowed to go through childbirth. Placenta previa and abnormal position, shoulders lodge, or they don't foresee the baby coming out on its own without some kind of physical intervention. Okay, so you could ask your doctor, your physician, about their C-section birth rate. More than likely, they don't track that information. But just out of curiosity, just ask your physician if they do, and if they did, and what their C-section birth rate is. If it's super high, that's a red flag. If it's low, that's pretty good. But more than likely, they'll say they don't carry that data. But definitely ask them how comfortable they are doing a C-section. Okay, so just before we begin diving really into this, what your physician is not telling you about a C-section or your OB, we'll go over the basic things they might tell you. So I believe in informed consent. That means if you are given all the information, you as a mother and as with your family, you come together to make a decision that yes, this is right for our family. One other thing to note, if you're given an option, like I said in the last video, if you're given an option, more than likely it's not an emergency. With emergencies, you're not given an option. You're told what they're going to do and they wheel you away to the OR. If you have to wait for operating room, more than likely it is not an emergency. Emergencies, they need the operating room right away. They have actually triaged you as a less severe emergency patient. So therefore, they will need an hour to prep the OR, 50 minutes to prep the OR. They have that time. So if they have that time, more than likely it's not an emergency. Okay, the basic risk of a C-section to a child is breathing difficulties, and they could have surgical injury and possible infant mortality, as with all births. The risks to mothers include infections, blood loss, reactions to anesthesia. Not everybody can undergo surgery, and some are at higher risk of complications due to anesthesia, including death. Blood clots, surgical injuries to your bladder or bowel, increased risk during future pregnancies, and inability to conceive. My philosophy is that overuse of C-section actually is like a population control. Most women are only comfortable having those 3 kids and that's it. So as you see more popularity of C-sections taking place in society, you'll see more babies being born. Okay, so let's go into what your doctor probably is not telling you about C-sections. Okay, so when your baby is going through the natural birthing process, everything has a reason and everything has a why in this beautiful design of God's birthing process. When your baby is born and they go through the birth canal, they're being exposed to all sorts of healthy microbiome, and this establishes their gut health for the rest of their life. So when you hear people just want to conveniently schedule themselves for C-section, these are people who are not privy to this information, and their doctor is not saying, wait, are you sure you want to do this? Your baby will not have the healthy microbiome, as well as other risks that could occur. Something more risk, looking through the research, you have a higher risk of lymphoblastic leukemia. You have a higher leukemia risk in children born by C-section delivery and pre-labor delivery. That means before you go to labor, you either elective or otherwise. So these are major health implications for your child that's being born, and it's not really a good place to put your child into. I believe that one was 2020. Another study that I came across said that with young babies born through C-section, female babies, they are more likely to experience early onset colorectal cancer. So these are the risks that they're not telling you. They might not tell you because this research is very new. It's within 2 to 3 years, okay? And so how it will translate into the future with C-sections is something to be seen. So leading on to this, I was just thinking about it, the Black maternal death rate, and I really wanted to drill down and figure out why is this occurring. So you had hospitals that will actually throttle the C-section rate. They only provided the same financial incentives to try to correct this process, and so they found that so C-section rate went down, but at the same time other health conditions may have occurred. Now, some of these patients may have other things that are comorbidities, like elevated blood pressure, things that will lead them to maternal death, other health factors that are coming into play. But I really wanted to dig down into the research and see why C-section rates were higher among African Americans, or maternal death, was higher among African Americans. So among the women, the Black Americans, among the women that elected to have a C-section, when you look at their insurance, 65% of Black mothers rely on Medicaid. Now, also looking into the research, doctors have negative perceptions of patients that are on Medicaid. So if you're on Medicaid and the doctor has a negative perception, you're not going to get the standard of care that you are looking for. In fact, some patients were complaining that they're 3 times less likely to get the birth of their choice. Most patients that were on Medicaid. So that's an intersection that I didn't even think about, but as I dove into the research, it clearly revealed itself. So I wouldn't want Black mothers to be particularly afraid of giving birth, but the fear and intervention really needs to be there, because we're seeing higher mortality rates with Black female patients that are having a C-section, that they go through the intervention roller coaster. This could be because of other issues. It could be obesity, high blood pressure, which leads to preeclampsia, but there definitely is that perception. And this doctor that I researched his videos, he actually recommends paying cash for birth, going through a midwifery. All patients have a better outcome going through midwifery, and the midwives are very responsive. And if there's an emergency, most of the midwiferys, my midwifery, Greenville midwifery, the first one was located 5 minutes away from the hospital. In the event of an emergency, you would be there like 90 going north, and they could usually tell well in advance if there's a decline in the health of the baby during the birthing process. So they're seeing that women who elect to go to midwiferys have much better outcomes, natural birthing. And they say there is a bias there because most patients that go there have healthy BMIs. They don't have they don't have anemia and other conditions where the hospitals accept everyone. But when you're looking at the research, the outcomes, mortality outcomes of mother and child fare much better. So just to give you another statistic, the infant mortality of C-section versus vaginal birth, the rate per C-section is 8.49 per 1,000 and 6.75 per 1,000 for vaginal delivery. So you're seeing a lower mortality rate of infant mortality rate. So And just a quote from one of the studies, the incident rate of dying given the method of delivery indicated increase among African American mothers who underwent cesarean sections. So every woman should avoid the intervention roller coaster. I think it's even unethical that physicians even prescribe it for elective purposes, knowing the research that is coming out about leukemia and other possible issues with C-sections. So, just to summarize the findings of studies, I have found another paper that they went through all the bodies of research on C-sections, current research, and out of 61 studies, they rated the studies to see how much of a consistency there was. Weak consistency means we cannot make any inference based on the result. So 61 studies occurred that were outlining the increased risk, post-birth risk of C-section. And they found that there was an increased risk of autism spectrum disorder as well as attention deficit hyperactivity disorder. And this was a medium strong consistency. So that is definitely something to take into account. And I'm pretty sure the physicians are not detailing all of the possible issues that could occur. Mothers, emotional, hormonal, she can't be bogged down with statistics. So there was another study, about 16 of this group of studies, and they showed that children who were born via C-section had higher respiratory tract infections, asthma, and obesity, and that showed a strong consistency. So that's another no bueno as well. There's another group of studies, or 19 in this category, that showed there's a higher risk of leukemia and certain cancers, and that study was a weak medium correlation. But even a weak medium correlation, if you present all these facts to a pregnant woman, that's something she definitely wouldn't flippantly say, okay, let's just schedule a C-section. Once again, I don't want these studies to be an indictment on any person that has had a C-section. Rather, it's what advice would you give your daughter or your daughter-in-law or anybody that you know and care about the whole birthing process and the intervention roller coaster, etc. What we have gone through is already the past, and the only thing we could do is learn from it, and we could advise others about it. So I don't want this to be perceived as an indictment against any mother that has succumbed to the pressures of this birthing system, because it is a lot of pressure. If you don't have a strong circle around you, a strong group of people, doulas, they now have birthing coaches. If you want a natural birth, you can now consult with a natural birthing coach, and they will guide you through the process. About the microbiomes, and some of these issues can be mitigated through breastfeeding, but the problem is most people who either elect to have a C-section or have been involuntarily, C-section involuntarily performed on them, they have a high cessation rate of breastfeeding, which means that they terminate breastfeeding very early on, so they're not getting the microbiomes from the breast milk. So I mean, these are all things, once again, they're not going to tell you, they're not going to give you that information in birthing classes. They're just, every woman knows she wants to avoid it, and every doctor thinks or most doctors might think it's convenient, and they just apply pressure. Some of them are not well versed on the current research, and some of them, in all honesty, as I've been presenting, like looking at education, looking at the birthing center, one thing is in common. As a society, we are just following orders. Most of these physicians are following orders by their healthcare administrators. Most teachers are following orders by their administrators. We have to start thinking about the processes that we're doing and how the ethical implication of them. So thank you again for joining me for another video. I do want to venture off into a different topic, but I think this is something we need a very rich, instead of sex education, I think we need a very rich course on birthing, taking care of a newborn, taking care of, kids all through their toddler period. We need education like that would prepare young women for what's ahead of them, that will detail all of these things to them and prepare them for their life. So once again, thank you for joining me, and stay tuned for another video. I'm trying to at least bring you a video on a weekly basis. Hopefully I could bring you more, and I do want to dive more back into the whole education system in America, and presenting the reasons why you should strongly consider homeschool. So stay tuned for that video, and thanks again for joining me. Have a great week.